So what if detecting cancer was as easy as breathing in and out? According to a study published in American Chemical Society, a new device made by Breath Tech can now detect diseases by simply sniffing a patient's breath. A team of researchers led by Professor Hassam Hayek of Technion Israel Institute of Technology, that's kind of like the MIT of Israel. They've developed an electronic nose called Nanos. It can detect 17 different diseases, including cancer. Dr. Kevin Campbell is an assistant professor of medicine at the University of North Carolina, the Division of Cardiology, and he joins me now on set. Dr. Campbell, can you kind of explain how this device works?
You know, it's really interesting technology. What we know is when cancer cells make big cancers in the body, they actually release certain molecules, and these molecules get into the bloodstream, ultimately to the lungs, and they're unique to those cells. And then when this breathalyzer machine that you just described analyzes the breath, you can tag that particular breath as being associated with that disease. It's really cool technology.
It really is. You were telling me that this idea has actually been around for a while. So explain to me, how is this device different?
So this device has been around a while, but not this particular one. This particular device has made the most progress and has actually been able to show us that we're having strep throat or multiple sclerosis or Crohn's disease or certain types of cancers. And this is important for this reason. A lot of people get cancer's detected because they have a lump or a bump and they get a scan, and by that time things are really far down the line. If we're able to detect things early, outcomes are going to significantly improve.
I mean, what caught my attention, the research says the device could detect lung cancer, Parkinson's in the early stages for people who aren't even showing symptoms. How is that possible?
So what we see is these cells are making abnormal chemicals and abnormal molecules when they're infected with an infection, or if they are, showing signs of cancer or that sort of thing. And those molecules can very specifically be analyzed by the machine. We've got a long ways to go in this, but I think this is very, very promising.
It seems so fascinating. Scientists sampled the breaths of more than 1,400 people that could be diagnosed with 86% detection rate. That's pretty good. But in your opinion, is this ready to come out and be used by a wide array of people now?
I think what we're going to see is a lot of clinical trials. The FDA is going to require a lot of data. We need some randomized controlled clinical trials. We need to make sure that when you tell someone you probably have ovarian cancer, you have this, and then we treat you for it, that we want to be accurate about this, because these are cancers that, like ovarian cancer, for example, by the time we detect it with a scan, it's so far along that the cure rate is very, very low. This could change the way we detect and treat chronic disease.
We know that a lot of these new technologies can be incredibly costly. How is that going to impact patients, do you think?
I think we've got to see how healthcare reform unfolds. We got to see how we're going to pay for things in the future. I personally would love to see access to technologies and medicines for every American, and I think that's something that our folks in Washington have got to work on very hard.
So for folks who are eager to get tested on this device, how soon might we be able to get it here in the U.S.?
I think we're talking probably years. We're probably talking 1 to 3 years, because they have just this seminal paper, and now they need to make sure that this is an accurate device that's, going to help us and not harm us, because we don't want to misdiagnose.
Fascinating device. Dr. Kevin Campbell, thank you for joining us.
Thanks for having me today.